for specialized training in swallowing problem and surgeries from US Davis, California. She has various research papers published in India as well as international journals. She also has co-authored a chapter titled Injection Laryngoplasty in the book Textbook of Laryngology released in 2017. I welcome to ma'am and hand over the sessions to ma'am for today's hoarseness of voice. Madam, please.
Thank you very much, Dr. Sharad. Finally, we have made it after a lot of technical glitch today. At the outset, I would really like to thank Navi Mumbai Doctors Foundation for giving me such an esteemed opportunity to talk on behalf of what I love the most, that is hoarseness of voice. I am Dr. Farha, Kazi, voice and swallowing disorders specialist practicing in Nehru, Navi Mumbai. So before we go on to hoarseness of voice, I would like to explain how exactly does the voice work. Now, voice is dependent on three major pump systems or dependent systems in the body. One very important being the lungs, which is responsible for throwing out the air to go and vibrate the vocal folds that is present in the larynx. The striking zone of the larynx, which causes vibration, only produces some sound, which is further articulated and produced into sounds and vowels by a lot of structures in the mouth, which includes the tongue, the palate, some resonance from the nose, as well as the paranasal sinuses. Now, coming to hoarseness of voice as such, when a patient visits our clinic, he tells us a variation of a lot of vocal quality. Some patients may say that I have a very raspy voice. Some say that I have a very rough voice. Some directly say that, yes, my voice is very hoarse. Some come with a weak, strained, and effortful voice. Some come with tremors. Some with quite a lot of breaks in the voice, a strangled and a creaky voice, and some come with a very breathy voice wherein they are not able to produce any sound. Evaluating these patients with hoarseness of voice, other than clinical history based on how long he's had the hoarseness, associated symptoms as to any fever or any pain in the throat or any loss of weight, something very simple that is done by most of the ENTs in their OPD is something called as the rigid laryngoscopy. Sometimes we also do flexible laryngoscopy, wherein we visualize. Okay, I think someone just got unmuted. Yes, in which we visualize all the vocal folds, the structures around the vocal folds, tonsils, the vallecula, to see if there's anything else that we need to look for. But there is something very special that I do in my OPD, wherein we look at the vocal folds in action with a very specialized examination, which is called as stroboscopy. I'm very happy to say that as far as now, I'm the only one who has this stroboscopy in my clinic at the outset. So in stroboscopy, I want you all to have a look at these vocal folds, wherein we are seeing the movement of the vocal folds in slow movement. So at one point of time, the pitch or the frequency of a male voice is somewhere around 100 to 120 hertz. That is, in a minute, it's vibrating for about 100 to 120. While in females, it's more than 200 to 250 hertz. So stroboscopy is a specialized light which helps us to visualize these vocal folds in a very slow and real-time manner. What all do we see in a stroboscopy? We see how the vocal folds are moving, how well they are vibrating. Are there any growths or redness on any particular vocal fold? Do they close completely? How soft or pliable do they look? How about the lubrication on the vocal folds or any extra mucus is present? So this is called as stroboscopic examination of voice. The common benign problems that all of you might encounter in your clinics would be an acute laryngitis or a chronic laryngitis, which most commonly we give the blame to acid reflux, lot of muscle strain in the neck, some vocal nodules, some hemorrhage and vocal fold paralysis. I'll be talking each of these in a little bit of detail. Now coming to acute laryngitis, it's usually rapid in onset. So the patient comes to you usually within 2 to 3 days saying that my voice is hoarse for like 3 days, for 5 days or 7 days. Usually we give the reason being a viral infections. Sometimes there might be a bacterial infection also, some cough associated with it, some fever associated with it. Whenever we are looking at the stroboscopic examination of these vocal folds, we see a lot of inflammation, some redness, some streaks of redness, and a lot of stiffness, which might be because of edema or swelling. The next laryngitis would be chronic laryngitis. A lot of you might be in your clinic who come to say that I have a lot of hoarseness, but it's really bad early in the morning. Or there is something stuck in my throat. I cannot swallow. Early in the morning, I get up and there is a very bad taste in my mouth. I get a lot of cough, specifically when I'm lying down, or when, especially in the night when I'm waking up with some cough. Or there is constant throat clearing that I have to constantly keep doing to clean up my throat. And they have sore throat intermittent. It's been there for quite a lot of months. So when we see such patients, I want you all to give some importance to this particular area of inflammation over here. We call this as pachydermia. Pachydermia or swelling, which is some kind of edema in the posterior glottis. This is because of reflux laryngitis. Number 2 would be some kind of streaks of redness that we see. So there is some kind of inflammation that is happening over there, and the patient, as a result of which, is having intermittent hoarseness of voice. Because of all of these, either because of an acute laryngitis or because of chronic inflammation, what happens is the muscles around the vocal folds, they go into a lot of spasm or a lot of strain. So there is a constriction right above the vocal folds when they are trying to talk or produce sound. So the patient says that I'm not able to produce sound properly. There is a lot of pain in my throat. Specific symptom of patients with muscle strain is, as the day progresses, I'm losing out my voice. So that is an indication that this patient has some muscle strain right above the level of vocal folds. The next symptom would be vocal fold nodules. These are also called as singer's nodules or a musician's nodules or a teacher's nodules, wherein patients who have a lot of usage of voice and the technique of usage of voice is not proper, we can get 2 bumps here at the junction of anterior 1/3 and posterior 2/3 of the vocal folds. This junction is called as the striking zone, where there is maximum striking of the vocal folds that occur, and as a result of which the patient has those tiny bumps over there. Now, there's something very similar to callus, but you really don't have to worry about these nodules like how we would be bothered about a thyroid nodule or a breast nodule or a lung nodule. These are very benign, and it's usually because of a wrong voice technique. So the patient comes to you with a very raspy voice. I can't properly, there's something wrong with it. So there is a lot of air escape that happens because of this incomplete closure of the glottic gap. So the patient comes with a very raspy and a breathy voice to you. And at the moment you ask, what is your voice? What's your profession? She might say, I'm a teacher, I'm a professor, I'm a singer, or I'm even a lawyer, and I had to use a voice quite a lot big. The next diagnosis will be of a vocal fold hemorrhage, wherein the patient comes to you, says that there was a Diwali party at home, there was some this, there was Ganpati, and then immediately after that, my voice is gone. So in this, usually, the patient has this acute hoarseness that suddenly comes because of a particular bleeding point that happens onto the vocal folds. Now, because of this vocal fold hemorrhage, the patient is not able to produce the sound as much as you can. Collection of blood into the vocal folds causes some stiffness and some escape of air. Again, we manage these patients conservatively. The next is vocal fold paralysis. It's usually a unilateral vocal fold paralysis, wherein there is complete loss of mobility on one particular vocal fold. In this video over here, you'll be able to see that the right vocal fold is able to make quite some, and the left vocal fold over here is thin and it's bowing and not moving at all. Now, these vocal fold paralysis can happen because of certain surgeries, most common being a thyroid surgery. The other one being when they're doing a cervical spine surgery and they have taken an anterior approach. If they have done some lung surgeries. My video has gone suddenly. You're able to see, Dr. Sharat?
We are able to see and we can hear our voice.
Okay, lovely. Thank you. So the certain types of cancers like thyroid cancers, breast cancers, lung cancers, or some brainstem lesions can also affect the recurrent laryngeal nerve that supplies these areas. So the patient, because he's not able to close the vocal folds, it causes severe breathiness. So the patient may come with a very weak voice, as in, I can't. This is not proper. So some patients also come with difficulty in swallowing. Specifically, I feel like coughing whenever I'm taking any liquids. Now, what do we do with these? Most of them come to us for an examination thinking, doctor, do I have cancer? Because my voice is hoarse. So in cancerous voice problems, it's usually little rare compared to the other types of cancers that we see. So these are most commonly seen in smokers as well as drinkers. They have hoarseness over a period of time, and it is increasing or progressive hoarseness. Sometimes patients can also have some breathing issues. Sometimes even late patients may come with noisy breathing or stridor. So I want to have a look at this video. This is a specialized imaging along with stroboscopy that we have in our center, which is called as narrow band imaging. In narrow band imaging, what we are seeing is this lesion over here. What is the kind of blood supply? Is the blood supply more? How are the blood vessels running? So this gives a very rough idea to us in our OPD as to this lesion that I'm seeing. Is it cancer or not cancer? So whenever we have two options. Either we can go for surgical removal or radiation therapy. Usually for stage 1 and stage 2 cancers, I usually like operating and removing them endoscopically so that radiation can be kept at bay. But some patients prefer radiation thinking they'll have a better voice. But compared to what we have seen, both surgery for stage 1 and stage 2 and radiation gives us the same result with voice. So they have a very good voice even after that. Now, this is just an example of how the surgery is done for an operative patient. This is an early lesion of T1, wherein the vocal fold only has a tumor where everything else was removed. We did a complete excision of the tumor along with some margin removal as well. And patient has a very good voice post-operatively or post-surgery. Now, what is the non-surgical management of hoarseness of voice? So a non-surgical management is what all of us do. If at all there is an infection and acute laryngitis, we give the patient some antibiotics. For reflux, we give them PPIs. We tell them take some voice rest, do some steaming, don't scream too much. But still, if the patients are not doing well, like vocal nodules, wherein I have to sit and talk, it's not like because my voice is not proper, I can take a break from my OPD. I start with something called as voice therapy, which is very, very similar to physiotherapy. A lot of massaging and relaxation exercises are taught to the patients. Some patients have problem with their lungs. So we try to increase the strengthening of the lungs so that the output is better. All the patients are educated about vocal hygiene as to how you're supposed to take care of your voice, how to recognize when you're kind of abusing your voice, when to take rest, when to talk, what to eat, what not to eat, till your voice is working fine. Now, we all know that voice is such an important aspect of our personality that if we are voiceless, it causes a lot of psychological issues on these patients. It's not just only singers, not only doctors, even for day-to-day communication, voice is a part of the personality. So quite a few of these patients also require some amount of psychological counseling to fight up to it and have a good voice. So surgical management of voice problems, nothing very great or very, troublesome about it. Nothing like, will my voice go away if I get operated? Not at all. They're usually microscopic, minimally invasive surgeries we do, and most of them are done with laser. Usually takes around 30 to 60 minutes. There are few lesions like very small polyps or very small papillomas. We can even burn them with laser in the office when they come in endoscopy rooms. The recovery is brilliantly fast, and some voice rest is required after surgery, and you can get back to your normal working in some time. Now, this is an example of a hemorrhagic vocal fold polyp excision, which was done by me under laser. Small laser, small precision, almost bloodless, and the polyp is removed. So now the patient has a beautiful vocal fold. This is all that the surgery goes through. There is no too much of bleeding, no too much of charring, no too much of scarring even. There is a procedure for vocal fold paralysis that we do. For vocal fold paralysis that we do, wherein we inject few materials into the paralyzed vocal fold through a transthyroid approach. So here the patient is lying down and we are putting a needle through the thyroid. I want you all to observe this video. The right vocal fold is a paralyzed vocal fold. So we are trying to put in through the needle, through the thyroid cartilage. You can see that prick that is coming out here, kind of a bump. And now I start injecting the material into the vocal fold and you can see that ballooning up. So once this balloons up, the patient has a working voice till his paralysis is taken care of. The other way in which we go inside ballooning up this vocal folds is transbronchial. We use a TB and a needle, directly go into the vocal fold and we inject these materials like hyaluronic acid. They stay for say about 6 to 9 months. Till then, the patient will be able to phonate and vocalize, and we're also giving time for the nerve to return back from its paralysis. So the patient is not going to be voiceless during this phase. Now, these are just examples of few surgeries that we did and the patients. So this patient came to me with hoarseness of voice, homemaker, and she had this hoarseness for about 4 months. Please let me know if the voice is audible or not.
It's audible.
So on examination, we noticed that on the left vocal fold, there was a small bump. This pearl-like thing that you're seeing is called as a vocal fold cyst, like a cyst that appears anywhere in the body. Now, other than this vocal fold cyst, everything else appeared normal. So this is my patient's voice after surgery. She was very happy. Now she's not met me yet for quite some time. I think she's doing. Now this is my another patient. This was a teacher who had been in teaching profession for past 5 years. And she said she had on and off quite some hoarseness that was coming and going. So on examination, we saw that there was a small polypoidal lesion, but can you see this marks over here on the vocal folds? These are all scarring that we call as sulcus vocalis. This is usually now in this, typically we remove the polyp as well as deal with the sulcus vocalis by removing some amount of mucosa and making it more pliable. So this is her voice 1 month post surgery.
Our audio is little less actually.
Yes. So she's back to work and doing her profession. Some amount of vocal hygiene was taught to her. Now there is an entity called as spasmodic dysphonia, in which the patient has those laryngeal dystonias or a very strained voice because of a lot of neurological lesions. And most of the time we have seen that MRI brain is absolutely normal. It is only localized to the larynx. So this is a small video that we have done of a patient who had spasmodic dysphonia. A very young girl. So we inject Botox into the muscle that supplies the thyroarytenoid. So post injection of Botox into these muscles, after say about 10 days, she has a smooth flowing voice. Now, how long will she require the Botox depends on patients to patients. Few come to us in 6 to 9 months. Few take at least 1 to 1.5 years. So with this, I would like to thank all of you for this opportunity. But before ending, I want all of you to listen to the perks of working with voice is having few beautiful singers who come to our clinic. And once they have a beautiful voice and they're back, this is how they sound. Let me know if you can hear them.
He is singer, Dr. Miss Vaidya?
Pardon me, sir.
No.
So this is the other singer in my OPD.
Her voice is not coming to us.
Not able to hear?
No.
So this is how my OPD sounds sometimes. Sometimes it's usually very raspy. So with this, I would really like to thank all of you for giving me a lovely opportunity today to present my work. Thank you very much.
Thank you, ma'am. I request to the participant, those who are having the
Hello, ma'am.
Yes.
I want. Can you please play again, because we are actually unable to hear both the records.
You were not able to hear?
No.
Okay, let me just play again. Tell me if you're able to hear. Let me increase the volume totally. Now?
Oh, ma'am.
Both singers' voice is not coming to us.
It's not coming? Oh! Let me try, but I really want you guys to listen to these guys. It's lovely. Not even now?
No, only their actions are coming to us in very situation.
Maybe I'll send it to you guys. I think I'll do that.
Yeah. I request to the participant to, if they are having any queries, please go forward. Achha, madam, I want to ask you about the spasmodic and the Botox. If you do in a very regular basis, or we have to be continue after certain particular gaps to maintain their voice?
Yeah, so it depends on patients to patients. Always tell your patients with spasmodic dysphonia that Botox is not the final answer.
Madam, please stop your share screen.
Sure, I'll just do that.
Okay, right.
Okay, now?
Good.
Yeah. So Botox is just going to help you relieve your spasms. Now, after we give a Botox, say 10 to 15 days later, we have a very nice flowing voice. Now, how long will they require a repeat Botox? Again, depends patients to patients. Some come to us in 3 months, some come to us in 6 months. So you will have to counsel your patients that they will be requiring repeat Botoxes.
Because see, we are as practicing Navi Mumbai and APMC
Yeah.
market is very near to us. Many of the professionals as well as the businessmen, because of their APMC, they are shouting for their business. The vendors are there. Even the women also, those are vendors, are shouting for their sale and everything. Because these are like some of the cases which are always asking, keep on asking actually to what to do for our hoarseness of voice, because it gets spasm. I cannot even having little swallowing problem as well as the hoarseness of the voice. So how to overcome by taking the just treatment conservative, or we have to go with the surgical?
So what we do with these patients is we start them off with some relaxation exercises like voice therapy that we call. Let them take this therapy for a period of 3 weeks. Now, say almost 80 to 90% of these patient bulk will respond very well to your vocal hygiene and therapy. Now, in case you don't respond, say 1 month and 1.5 months, then definitely surgery is the solution. But always remember that after we do a surgery, they still have to do some relaxation exercise, because if they've been screaming and there is always voice abuse, thoda sa exercises at home will always help them for long-term gain. Like how we would deal with singers.
I have one question, like which patients need urgent attention, like I'm putting red flags in hoarseness.
I can't hear you, sir.
Red flag in hoarseness, which patient need urgent attention?
So usually hoarseness lasting for 2 weeks or more, then definitely they have to get themselves examined. If you're talking to me about red flag, if you're thinking of a cancerous lesion, then associated symptoms like loss of weight, breathing issues, immediately they have to be examined further, either laryngoscopy along with a CT scan as well.
Madam, age-related changes in voice and management.
So that is going to be, ma'am, a lot of voice therapy techniques only to keep it long lasting. How we would want our patients to do some amount of physiotherapy to keep their body moving well. Voice therapy definitely helps. For the tremors, there are definite examples of either you can start off with low dose of propranolol that helps in, keeping the tremors under control, age related. Otherwise, voice therapy helps quite a lot.
One question is there, madam, what kind of precaution we should take to for good sound or for preserve our sound?
For
good sound or preserve our own sound, what precaution we should take?
Well, what do you mean by good sound? Like good voice? What
Yes,
exactly
good.
is the question, sir?
Yeah.
For a good voice, see, as doctors and you people see so many patients in a day, there are 3 things that I think is very handy that all of us need to do is keep a small water bottle with you always. Take sips of water very regularly. Don't allow this region to get dried up because of excess use. Number 2, whenever you're talking and sometimes what happens is after a set of patients, you will feel some strain in the voice. Just take something called as a voice nap. The voice nap is just a small 3 minutes break wherein you're not talking. Number 3 is go home and take good steam. These 3 will help in longevity of your voice.
And about snoring also hampers your sound.
Snoring, so then you have to really get evaluated as to why you're having that snoring. Now see, most of the patients who meet us for snoring, not everyone is a surgical candidate. So the first thing that all of us are telling these patients is you have to go ahead with lifestyle changes. If there is obesity, take care of your obesity. If there is any cardiac problems, take care of those cardiac problems, thyroid issues. Even beyond that, if there is snoring, then get your snoring evaluated. Ki kyun ho raha hai? Why exactly you're having? Is there any nasal block that is causing snoring? Is there any throat or tonsillar issues that is causing snoring? But almost 60-70% of your patients, you will notice that the moment they start losing weight, the snoring also comes down. And you have these special pillows that is there on Amazon as well. You know, those veg pillows, I think most of them must be knowing. So those also kind of prevent you from snoring, or at least help you.
One question in chat box, how local hygiene is done and what is the process?
So vocal hygiene is very similar to what I just said. So for example, if I'm a person who talks quite a lot throughout the day, there are a few exercises that are taught to the patient for the relaxation of this. Now, something very similar would be, if you really want to try it right now, is we pucker our mouth and try to say, feel the vibration passing through this. So this kind of relaxes all these muscles over here. Number 2 is laryngeal massages that you do. Number 3 is good amount of water, and try to cut down as much as possible of your caffeine and tea intake, and non-oily, non-spicy stuff. So in that case, your vocal folds are not abused quite a lot. So these are just a part of vocal hygiene programs. But as such, you know, we people do have quite a lot of talks and a lot of vocal hygiene training that we do. Maybe next time we can take that itself in particular, and all of us can do that.
Yeah, madam, we would like to take many more sessions with you, because there are a lot of questions are there because of the limitations of times. So we rest now.
Awesome.
Thank you. Thank you, ma'am.
Thank you. Thank you so much, everyone.